Hi, everyone, and welcome to this webinar about fluoride varnish. My name is Dr. Shaadi Manoushehri, and I'm a dentist practicing in London. I've been a dentist for about 10 years now, and my practice is predominantly private practice in Marylebone in central London. I would like to thank the sponsors for for sponsoring this talk. Kettenbach, if you're unfamiliar with them, hopefully you should have a bit more of an idea of their products and what they're about during this presentation. The aim of this presentation is to introduce you to the Profisil Fluoride Varnish, which is Kettenbach's a fluoride varnish that's been launched. And we're going to cover everything there is to know, everything that you need to know about fluoride varnish and how Profisil differs from their competitors out in the market at the moment. So, Profisil Fluoride Varnish, a professional solution to effective preventive care. So, our learning objectives for this lecture are to understand the key features and advantages of the Profisil Fluoride Varnish in preventive dentistry in particular, learn about the efficient application process and how it impacts our clinical workflow in practice, explore the benefits of fluoride varnish in caries management as well as dentinal hypersensitivity relief, and recognize how single-use packaging can enhance infection control and reduce waste. In dentistry, we do create a lot of waste, and especially now where we're all being more environmentally conscious and more sort of eco-friendly, then it's always something to bear in mind, as well as the clinical benefits of the product. I personally, as a practice owner, do tend to focus on other aspects of it as well and try to be as responsible environmentally as we can. So it's always positive to consider how we can be more environmentally responsible in dentistry as well. So, understanding fluoride varnish. I'm sure you're all familiar with fluoride varnish, but it may have been some time since you've really listened or remembered or recapped about what fluoride varnish does, how it works, and when we can apply it in clinical dentistry. So, what is fluoride varnish? It is a concentrated a form of fluoride that we apply onto the surface of the teeth, and it can manage various oral health concerns such as caries management and dentinal hypersensitivity in a wide range of patients. So, it could be adults, it could be children, and we're going to go into who is our target audience and who would benefit from fluoride varnish application a little bit later on. Generally, the properties that we want from a fluoride varnish is for it to essentially stick to the teeth quickly and continue to release fluoride over a period of time. So rapid adhesion and ongoing release are really, really positive things about fluoride varnish that we use in dentistry. So the varnish is actually designed to quickly stick to the teeth and make sure that it's covering enough enamel surface, set or harden really quickly on the surface of the tooth, and strengthen weakened enamel and continue to provide resistance to acid attacks. So, for example, in the caries progression process, its fluoride is designed to provide resistance and make the teeth stronger from within, and also to address dentinal hypersensitivity in the cases of exposed dentinal tubules. So fluoride varnish will not only provide protection whilst it's on the teeth, but it will actually continue to release those fluoride ions and provide protection for some hours after it's been applied. And we will cover the properties of Profisil in particular a bit later on that makes it ideal and where it stands in the market compared to the other competitors. So the traditional approach of how fluoride varnish is applied, I'm sure you're all familiar with this, and you might have different protocols in your practice or be used to different things depending on the type of patients that you see and the resources that you have in terms of time. So traditionally, what would happen is the teeth would need to be thoroughly cleaned to remove that plaque layer, that pellicle layer. And that may be done by the dentist themselves, or it might be done by a hygienist prior to the dental visit. It can vary, but usually the recommendation is that the teeth are thoroughly cleaned before fluoride is applied to the surface of the teeth. The recommendation is also that the teeth are nice and dry, and that can be quite challenging in compromised situations. So, for example, with children, with their level of cooperation, you can never be sure. So, keeping the teeth dry and cleaning the teeth could be a challenge prior to fluoride varnish application. So, although the application itself might not be that much of a challenge, it might be a straightforward process. Preparing the teeth and making sure the situation or the circumstances are ideal for the application could be somewhat challenging. So in the traditional approach, the teeth are cleaned and then they're dried thoroughly. You might want to isolate the teeth with cotton swabs or dry guards, anything like that, depending on your personal practice. And then the fluoride varnish is applied. And traditionally, we would have like a tube of the fluoride varnish, which would be dispensed. So your assistant or yourself, you might dispense that on a pad and then go in with a micro brush and apply that onto the surface of the teeth. Now, it's quite difficult to gauge how much you're going to need depending on the patient's need, their dentition, and what they're presenting with. So sometimes this could be quite wasteful. You might use more or you might dispense more that you need. It can actually also be quite difficult to maintain infection control at times because you're using that tube for a number of patients. Obviously, we have to be mindful of infection control protocols and make sure that everything is clean whilst this is being applied because that tube is being used for multiple patients. So as long as it's going on a clean pad with a micro brush, that's obviously fine. But we do have to just be mindful of infection control protocols when we are going down that traditional approach. What happens to the varnish is that it will usually set within minutes, and that will allow patients to kind of resume their normal activities, such as eating and drinking, soon after. The usual recommendation is for us to advise the patients to stop eating and drinking if they can for about 4 hours um, following application so that that fluoride can really harden and continue to do what it needs to do as much as it can to have the maximum benefit straight away following application. So frequency of application, it can vary. So it can vary on the patient's needs, depending on the patient as well as their dentition. So we need to ascertain why we're doing this. What is their caries risk? And is it for caries management or is it to manage dentinal hypersensitivity? And then we can ascertain the frequency of application. We do, of course, have some guidelines. So Public Health England at the moment it recommends twice a year fluoride application for children under the age of 3, and that's regardless of their caries risk. So whether they're low, medium, or high risk, Public Health England advises that we apply fluoride varnish twice a year. And that is the recommendation for their exam. So the idea is that we see them every sort of 6 months. We check their teeth. We possibly clean their teeth if possible. That can be quite challenging in 3-year-olds. And then we would apply the fluoride varnish and continue to give advice. And that's also kind of an incentive for them to come back as well. So the application of fluoride varnish should obviously be tailored to individual patient needs, and Public Health England at the moment advises twice per year fluoride application for children under the age of 3, regardless of their caries risk. If they are high caries risk, then obviously the frequency of application is increased. So we might want to see them every three months to apply the fluoride varnish. And that's, of course, a good idea to get high caries risk patients in to kind of continuously motivate them. So not only are we kind of checking their teeth, applying the fluoride varnish, but that's also a good motivation for us to remind them to brush and floss their teeth. I don't know about you, but with my patients, every time I see them and I ask about their oral hygiene routine, it's always, when I saw you last time, it inspired me to continue flossing for a couple of months and then I fell out of the habit. And that's a very common occurrence with a lot of patients of varying backgrounds in terms of their age and caries risk. So we do want to see them regularly to just remind them of those ideal oral hygiene habits to protect their teeth and maintain their oral health. So, with high caries risk patients, those who have caries already, who have had multiple fillings or multiple caries, who have a cariogenic diet, who might not have an ideal oral hygiene routine. So, every time we see them, there's a lot of buildup of plaque. Those are patients that we would consider high risk. I'm going to cover this a bit later on in terms of the patients and who's considered high risk and what we want to be looking out for. But anyone that we deem high risk for caries, may require more frequent fluoride application, possibly every 3 months, and that's the current guidelines at the moment. So, mechanism of action. How does fluoride work? I'm sure you're all familiar with the diagram of this tooth and the outer enamel layer and the layer underneath. So, fluoride works in different ways to minimize demineralization or manage caries, essentially, as well as manage dentinal hypersensitivity that is caused by open dentinal tubules or exposed dentinal tubules. So the first way that fluoride works is by inhibiting demineralization. So when there's an acid attack in the mouth, the pH would drop below that critical pH. And that's the point at which the hydroxyapatite in the enamel will start to demineralize. So if there is fluoride present, it will inhibit or reduce that demineralization process, which is amazing for people like myself who have a sweet tooth and who will have regular sugary snacks. If that process is reduced or managed, then that's going to make a huge impact on the rate of caries and caries starting and also progressing. Current research is showing that fluoride can reduce or inhibit demineralization by up to 70%, which is a huge number. So it can be very, very effective. And this is very important when we're educating our patients about fluoride toothpaste and fluoride varnish applications regularly. It can have a huge impact. So first way that fluoride works is by inhibiting demineralization. So when that critical pH is hit in the mouth, hydroxyapatite will start to dissolve or demineralize, and fluoride is going to inhibit that process from happening, therefore reducing the risk of caries. And it's going to protect teeth from cavity formation. It's also going to promote remineralization. So we're going to get incorporation of fluoride ions into the hydroxyapatite. And fluorapatite is a lot stronger than hydroxyapatite, and it's a lot less susceptible to dissolution by acids. Now, obviously, when the teeth are forming, and for children under the age of 7, that process is more impactful. It's more frequent, and that's happening a lot more, whereas that can still happen in adults. So the fluoride ions do get incorporated into the actual tooth structure and makes it stronger and more resistant to dissolution by acids. So fluoride also promotes the remineralization process, and it helps to repair and strengthen that weakened enamel on the teeth, which again is amazing for patients who are high risk. So if they're having sweets a lot, then fluoride is going to inhibit demineralization and promote remineralization, which is what we want. And fluoride is effective in areas where there's plaque. So fluoride stays in the biofilm, and that ion exchange, I'll have a slide on it later on, but that ion exchange means that in the biofilm, the fluoride ions do get incorporated into the hydroxyapatite. So it can be effective in areas where there is plaque, and it can reduce the risk of cavity formation in these areas. Fluoride can also be effective in reversal of early tooth decay, and this is very, very important. And patients are often so surprised to hear about this because they think as soon as they have decay or they have a cavity, they need to have a filling. And if the lesion has cavitated already and has spread to the dentine layer underneath, then of course they need a filling. But in the early stages, as long as the demineralization process or that radiolucency on your X-ray is within the enamel layer and it hasn't spread to the dentine layer underneath, we can actually reverse that process and promote remineralization of the weakened enamel in that spot. And this is something that I tell all of my patients if they are high caries risk. I show them the X-ray. I say, listen, there's these areas that could potentially need fillings, but as long as you're maintaining good oral hygiene, you're using fluoride, if applicable, if we're applying fluoride regularly, then you can actually reverse that. And for children, obviously, the idea of having fillings is not ideal. So telling them simply that they might get away with not having a filling is enough motivation for them to use a fluoride toothpaste and stick to those really, really good oral hygiene habits. But as adults, I think something that they motivates them even more than children is telling them how much fillings cost. And that's usually enough motivation for them to get flossing and cleaning it between their teeth. So this is usually how I would motivate them. I'd say this is at this stage, we can control it and we can actually reverse this process and make the tooth strong again. But if you don't floss, if you don't use a fluoride toothpaste, if we don't apply the fluoride, you may end up needing filling, which of course we want to try and avoid at this stage. And I find that that works quite well, motivating patients to carry on with their good oral hygiene habits. And they attend regularly as well because they know that there are these lesions that we're keeping an eye on. So if we repeat the x-ray in however long we need to, then we can compare those side by side and educate the patient. So this is amazing in patient education and also getting them to be motivated to stick to those good habits with regards to their oral hygiene, but as well their diet. And I am very big on making sure that patients have realistic aims within their lifestyle. I mean, we can't tell them not to have sweet things when we're popping off to the staff room and having a sweet, especially around Christmas time. There's always something sweet to be had. So I always make sure that my patients have realistic habits that they can stick to and realistic targets. So I would say you're allowed to have sweet things, but just make sure you limit the frequency rather than amount. So if you're having a chocolate bar, make sure you're not snacking on it throughout the day. Make sure it's done in one go. Stick to meal times so that the teeth are more protected. Follow up with things like cheese or water to help clear that acidic environment a bit quicker. So it's all about educating patients with realistic targets rather than say you're not allowed to have sweets ever because they'll cause holes in your teeth. That's not going to be very realistic and patients aren't going to stick to that. So I think it's very important for building the rapport and also, we're all human. We all want to enjoy the foods that we love every now and again. It's just about educating patients on how they can do that, how they can enjoy their favorite foods and still look after their oral health. So this I find is very important. So early tooth decay, we can reverse it. And usually what I would recommend to my patients is to use a fluoride toothpaste, obviously spit, don't rinse, and also to floss with fluoride on their floss or interdental brushes. And then when I see them for application of fluoride, if I need to, I will also get that varnish on possibly an interdental brush or use the micro brush to apply just between those teeth as well on areas that I know have enamel caries. And that also is really good as a practice builder because your patients know that they're returning again and again and they're investing in their oral health to maintain those areas and stop those lesions from progressing. So I would usually encourage them to use floss or interdental brushes, not only to clean, but also to deliver the fluoride specifically in these areas. And I will demonstrate it for them whilst they're in the chair and get them to continue with that as well. So the benefit of fluoride varnish in this case is that it's effective, it's non-invasive, and it can reverse decay in its early stages and also prevent cavity formation. So hopefully, if we spot these areas early, we can stop the progression and stop patients needing fillings in these areas. It's also a very non-invasive treatment option. It's topical application of fluoride. It's well tolerated by patients. A lot of them would rather have that than a filling, as we know. Excuse me. So fluoride's role in strengthening enamel and preventing tooth decay. So it plays a crucial role in strengthening enamel by integrating into its structure, making it more resilient and more resistant to dissolution by acids. So this is a slide that the diagram that I was talking about earlier. So on the enamel surface, we have the hydroxyapatite, as we know, and that hydroxyapatite usually is covered by the biofilm. And the biofilm has ions from the saliva and minerals from the saliva. And if there is fluoride present here, those fluoride ions can get incorporated into the tooth structure. So say, for example, the demineralization process below critical pH. So say this is the tooth in the mouth with the saliva, the pH has been hit at 4.5 to 5.5, which is that critical pH where enamel will start to demineralize. And during that process, the tooth will start to demineralize, but as it remineralizes with fluoride ions present nearby in the biofilm, it makes fluorapatite, which is of course stronger and more resistant to dissolution by acids. So that fluoride is not only kind of promoting that remineralization process, but it's actually getting incorporated into the hydroxyapatite to make fluorapatite, which internally makes the tooth stronger for future as well. So it plays a huge, huge role in preventing cavity formation. So the hydroxyapatite will convert to fluorapatite, which is more resilient and less susceptible to dissolution by acids. And then that floor appetite for future is going to be a lot more resistant to acid attacks. So this needs to be done regularly for patients through fluoride varnish as well as fluoride toothpaste so that patients can have that continued protection of their teeth. This is a slide showing the tooth. So this is a cross section of a tooth with application of fluoride as the competitors as well as the Profisil. So if patients present with dentinal hypersensitivity, we need to obviously ascertain what the cause of their hypersensitivity is. Is it exposed tubules or is it anything else? But in cases of exposed dentinal tubules, if there is hypersensitivity, we can manage this quite effectively with fluoride varnish application. So if you look at the slide on the left, that is demonstrating open dentinal tubules, and that's what's going to trigger that nerve response. So that's the sensitivity that patients feel to thermal stimuli. For example, if there's something cold, this is what they will feel because of those open dentinal tubules. So with application of fluoride, we want to try and cover those and protect them so that that nerve response is not initiated and patients don't suffer with sensitivity. So with the competitors, there is that coverage of the surface layer of the dentinal tubules. But with the Profisil fluoride varnish, there is an element, there's an ingredient in Profisil which is called dimethicone, and that's going to help it stick to the surface layer a bit better, and it's going to help cover those dentinal tubules a bit more effectively to offer enhanced protection from a sensitivity. So it goes a long way in providing long-lasting protection from dentinal hypersensitivity by sealing those tubules with minerals and providing continuous release for a period of time. So let's talk about the long-term effects of fluoride. Generally, we would expect to have lower rates of cavities. So regular use of fluoride varnish has been linked to a significant reduction in cavities amongst patients, and this is adults and children. Overall, it promotes improved dental health. So it enhances enamel strength and it protects against decay and acid erosion. And it's also preventive. So incorporating fluoride varnish application in regular dental care routine is an effective preventive measure for maintaining oral health and dental health. So let's go back again to the traditional approach of how fluoride is applied. And this is going to come in handy a little bit later on when we talk about Profisil and its benefits compared to the competitors. So first we would go in and clean the teeth, and this could be done by the by the dentist or the dental hygienist, for example, if before the patient comes to see the dentist. I know some practices have this protocol, for example, where they would have the patient be seen by a dental hygienist first, and then the dentist will either pop in or we'll see them separately for an examination. So teeth need to be cleaned essentially for a traditional approach to fluoride varnish application. The teeth need to be dry, and we dry the teeth and use cotton swabs as well as things like dry guards if possible. And as you can imagine, this can be quite tricky in young patients. So, for example, those under the age of 3, this is going to be quite tricky to do. So we would clean the teeth, dry the teeth, apply the fluoride on the surfaces of the teeth where we need to. And that traditional application is by dispensing the fluoride varnish or the fluoride paste from the cylinder onto the pad and then using a micro brush, for example, to apply that on the areas that we need to. And as we mentioned before, we just need to be quite mindful of that infection control process because obviously that cylinder is being used for multiple patients. And also another issue with this approach is that it can be quite wasteful. So we may be using too much or not enough. So if you're not using enough and then going back with a cylinder, and that can be an infection control situation that we need to be mindful of. It's going back on the same pad that's been used by the microbrush that's been in the mouth. Not that we don't adhere to these anyway, but it's just something for you to bear in mind, and it can increase clinical time, and it's just going to be on your mind when it doesn't have to be. And the fluoride varnish will set within a couple of minutes, and then usually we would just advise patients to avoid eating and drinking for about 4 hours afterwards as well. So again, with the traditional approach and the competitors, safety considerations and some potential side effects for us would be some mild side effects would be that some individuals might experience mild side effects like the discoloration of the teeth. So traditionally, the fluoride varnish would be a yellow color, and that can discolor the teeth temporarily. So if patients aren't aware of that, that can make for a very tricky situation. And again, depending on where your practice is and what kind of patients you're seeing, that might be not an issue at all, or it might be a big deal. I mean, we in this part of London, when we see patients, they can be quite to use the right word, they can be quite difficult in some areas where they're not aware or they could be quite image conscious. So if there's anything that might discolor their teeth, even temporarily, and they're not aware of it, they don't like that very much, whether it's children or adults. So that's just another thing for us to bear in mind. So with the traditional approach with the paste that's going on the teeth, it can make them look a bit yellow and discolored temporarily. So in some cases, that or fluoride varnish may elicit some irritation in the mouth, and it could irritate the soft tissues. And sometimes this could be because of the alcohol ingredient in some fluoride varnishes, and this can dry up the mouth or just irritate the mouth in general, or the flavors that are used might irritate the soft tissues, and patients might not be very happy with that. And again, teeth might be discolored temporarily due to that yellow color of the fluoride varnish. So let's go to target groups and accessibility. So who would benefit from fluoride varnish application? We've already covered that the Public Health England has advised that we apply fluoride varnish on children under the age of 3 about twice a year. And if they are deemed to be high risk of caries, we would usually do a more frequent application of fluoride, again, assessing that on their individual needs. If they're high risk, we might want to be seeing them every 3 months. Whereas if they're standard risk or anyone under the age of 3, we would do twice yearly applications. So children and adults, so children under the age of 3, regardless of their caries risk, above that age if they're deemed high risk, and adults if they're deemed high risk. And what do we mean by high risk? So if they've had previous multiple cavities before, if they've had multiple restorations, if they have a cariogenic diet, so they have a high frequency of sugar intake. And it's also very important to educate patients on what cariogenic diets consist of, because again, I don't know about you, but a lot of people that I see in my chair, if they have a lot of cavities, so if it's the first time I'm seeing them and they have a few cavities in their mouth, if I ask them about their diet and its sugar content, they do tend to get a little bit defensive in some cases. Um, and what I found is that they would instantly say, I have a lot of fruit. And that's great. That's great for your health. But fruit can be acidic. It can be carcinogenic depending on the type of foods that you're having. If you're having berries, can have a high sugar content. So it's just about educating them that, caries doesn't, or carcinogenic diet doesn't necessarily consist of Haribos or Coke or fizzy drinks or something like that. Sometimes dried fruits in particular, this is another thing that patients don't realize, that dried fruits can actually be quite bad for the teeth, and it can increase their caries risk by quite a lot because it's sticky, and often it will have added sugar on them as well. So things that could be marketed as super healthy, or things like protein bars. And so patients who are very active, who go to the gym a lot, they might be snacking on protein bars multiple times a day, and they do tend to have a really high sugar content. So it's about educating those patients. So even those super health conscious patients might have a carcinogenic diet and not know it. Another thing is also lemon water in the morning is very big. I see a lot of patients who have that every morning, and some of them might present with erosion and not know where it's coming from. So it's very important for us to educate our patients. And again, not in a judgmental way to say you shouldn't have any of this, but it's more about, for example, with lemon water, I'll say, we'll try and have it through a straw. And try and follow up with food and all of that straight away to kind of minimize the impact. So it's just about realistic goals that they can manage during their day. Because if they're not going to stick to it, if they're going to say stop having your lemon water, if that's something that's important to the patient, then the reality is they're going to continue having it. So it's just about educating them to kind of try and minimize the effect if possible. So patients undergoing orthodontic treatment, particularly fixed appliance orthodontics with adults and adolescents, can be high risk of getting decay. That's also could also be because of sort of compromised plaque control and just plaque retentive features in the mouth with their um, fixed appliance orthodontic appliances. So patients who could also benefit from fluoride varnish application would be those experiencing dentinal hypersensitivity because of exposed dentinal tubules. So, for example, if there's a patient who has lots of gingival recession and they have exposed dentinal tubules, even if they're not experiencing sensitivity at that point in time, it's very important to educate them and let them know that could be something that could happen in the future. So, as long as they're prepared and they know how to manage it if needs be. And patients with compromised manual dexterity and poor plaque control. So, patients with medical conditions, for example, rheumatoid arthritis, if they find it difficult to clean teeth, if there is multiple restorations in the mouth that makes it difficult to keep them clean, those are what I would consider high caries risk patients. And so, our target group and not our target audience when it comes to fluoride varnish application. So the benefits of fluoride varnish application for children and adolescents is dental decay risk. So we reduce that risk. Children and adolescents do tend to um, experience a higher risk of dental decay. That could be because of their diet habits or their oral hygiene habits. If they're not quite there yet, if they haven't formed those really good habits yet, they tend to be at a higher risk of getting caries. And fluoride varnish is essential in preventing dental decay and strengthening the tooth enamel during those times. Because also, what I see in my practice a lot is patients who may have had fillings that they had done when they were a teenager or a child, and obviously now they have formed those good oral hygiene habits. But back then they didn't have that because that wasn't a priority. So it's important to have that ongoing relationship and to make sure fluoride is strengthening the enamel. And also, regular preventive care, including fluoride treatment, is also crucial in ensuring long-term oral health for children and adolescents. And we want to encourage them to come regularly and have that fluoride varnish applied. And also, by them coming to the dental clinic regularly, it kind of sets in those good habits. And I think sort of having spoken to colleagues and patients, and even myself personally, I think forming those good habits at the beginning are crucial in making sure that you have good attitude to oral health care for your future. As a child, one of the reasons I became a dentist was because I had very good experiences at the dentist as a child. And I think again, focusing on preventive dental care. If you have memories of the dentist but they're bad, so if every time you've gone you needed a filling or an extraction or they weren't very nice, then that's going to form really bad memories and you're going to be traumatized and you're going to have dental phobia and anxiety as an adult usually. Whereas if you have had those good experiences, those are the things that you remember. So it's important to have those regular appointments with preventive dental care, fluoride varnish application, to get them in regularly so that they have those good memories of the dentist and it's not just bad memories from before. And we see this a lot in practice where patients who come and see us, they're okay now, but they've had, adults, like even in their 50s, 60s, who are still traumatized by the experiences that they had when they were, 10 or below the age of 10. So it's really important to get those good habits and form those good experiences at an early age. So other than children, who else is going to benefit from that? So which kind of adults are we looking at? So we're looking at adults who are high risk. So if they have, again, as mentioned before, who have a high caries risk because of their diet or their oral hygiene habits. Adults with a history of cavities or specific health conditions such as dry mouth. Again, target groups such as postmenopausal women might have a drier mouth than usual, so they will be at a higher risk of getting decay. So even if they do have those good oral hygiene habits, if something changes in their medical history, if they're taking lots of medication, if they've had radiation therapy or anything like that, then that might change the circumstances and they might suddenly be at a higher risk of decay. And anyone with impaired manual dexterity who struggles with plaque control. So this is going to be our target audience in the adult group. Also, as mentioned before, orthodontic treatment considerations. So, patients undergoing orthodontic treatments may experience an increased risk of cavities. So, fluoride varnish application could be particularly beneficial for those during fixed appliance therapy in orthodontic patients. So let's look at why fluoride varnish is good in terms of its availability and cost consideration. So it's widely available. It's very easy to get hold of for dental practices, and it's really easy to deliver to patients. In countries where insurance is a big thing, and even in the UK now, we're seeing more and more patients with private dental insurance. Dental insurance coverage is included, so it's not something that patients have to worry about, and it is a very, very cost-effective solution. So, in terms of the effect that it can have, it's not a very expensive treatment to have. So, for example, for those patients who have those early enamel lesions, regular fluoride application is going to be a lot more cost-effective for them than needing a filling. So, they're usually happy to invest that time and money into that process. And investing in fluoride varnish now and regular application will usually stop them needing much more expensive treatment in the future. And like I said, adults do tend to find that as a big motivator. So let's focus now on the Profisil Fluoride Varnish and what it does, how it works, and some of its benefits over the competitors in the market at the moment. So the Profisil Fluoride Varnish contains 5% sodium fluoride, that's 22,600 parts per million fluoride, and the gel is quite mucosa friendly. The good thing and the unique thing about this from a patient perspective is that there is flavor variety. So the flavors could be berry, could be mint, or it could be unflavored. So I don't know about you, but what I used to do before is I would kind of tell my patients that this is going to taste a bit like a banana or a bit like toffee or something like that, but it never quite translated to patients, and they were always confused. And sometimes they would say, "Yeah, yeah, it does," but some might find that it didn't. So this way we have the choice, and we can give them the choice of mint. Like a lot of adults would go for this flavor, berry for children, or unflavored. And that is one of my favorite things about Profisil is that it comes in an unflavored variety for those who don't want that artificial taste, for example. It's colorless and it's odorless and it is transparent. And again, this is another unique thing that makes it amazing and very well tolerated by patients is that they don't essentially feel it and they get that protection without having to put up with an unpleasant taste, color, scent, or something that they're not prepared for, essentially. It can be applied in all directions. So the physical properties of it make it very, very good at adhering to the surface of the tooth. So you can apply it in all directions, which is really good if your patients are non-compliant and for example, children under the age of 3, if they're kind of wiggling about in your chair, you can apply it in all directions and it will adhere to the surface of the teeth. Another crucial thing that I love about Profisil is that no pre-cleaning or drying is required. And this is going to result in a significant reduction in clinical time required. And it really streamlines that clinical workflow and that you don't need to clean the teeth or dry the teeth to get the maximum benefit from this fluoride varnish. It is alcohol free, so when it's applied, the patients don't tend to experience a burning sensation or that soft tissue irritation because some of the products out there can have alcohol, and that can not only kind of dry out the mouth slightly, but it can also cause a burning sensation or a bit of irritation to the soft tissues. Now, the benefit of this is that we don't experience that. The gel itself, again, the physical properties of the gel, it has a dimethicone gel base, which adheres to the tooth surface really, really well for several hours, and it continues to release fluoride ions for up to 24 hours, which is amazing because once you've applied this, then this is going to continue to work for a number of hours. It's not going to wash away straight away. And that dimethicone gel that just makes sure that it adheres to the surface of the tooth and it can continue to release those fluoride ions for up to 24 hours. That it's non-allergenic, so we're minimizing the risk of reactions, which is again amazing. And the reason for that is that there's no colophony. Sorry if I've pronounced that incorrectly. And that tends to reduce the risk of allergic reactions. So the physical and chemical properties of this product are ideal, and they have a lot of properties that makes it a lot easier for patients to tolerate, but also for clinicians to apply. So if we look at the benefits for the dental professional as well as for the patient. So this is what the product looks like. So this is the single dose blister, and it's amazing because you have the exact amount of fluoride that you need here. So there's no dispensing required. So you're not guessing how much you need. And this is a single use blister dose with the micro brush in there. So all you have to do is peel this off, apply it, and then you can get rid of this. And it's amazing because it reduces that infection control. It really reduces the clinical time that you need to prepare, and it really streamlines the workflow. And this particular one is the unflavored variety. And again, they come in those three flavor options. So this makes it ideal, and this covers both arches, top and bottom. So it's all you need for a single application, and it can be applied in all directions on the surface of the tooth. So even in difficult to reach areas, you're able to get this all the way back. You don't need to clean the teeth, and you don't need to dry the teeth, which saves an immense amount of time. And the non-clumping formula is amazing. So you can just apply it on the surface of the tooth, and it's also transparent and odorless. So again, for the patients, this is an amazing thing. So patients really like the consistency of it. It doesn't clump. It's a transparent gel that just glides onto the surface of the teeth, and it will close those or cover those open dentinal tubules to prevent hypersensitivity. There's no bitter taste and there's no burning, and that's because there's no alcohol in the formula. And it's a non-allergenic dimethicone gel. So again, ideal properties for the fluoride varnish whilst making sure that it's not kind of irritating the soft tissues or having any kind of reactions for the patient. And it's suitable for all ages, adult teeth, children. So mixed dentition, primary dentition, this is suitable for all of those. So this is just an overview of the Profisil and what you could get for the practice. So you have the three flavors: mint, berry, unflavored. There's no alcohol and there's no colophony. Again, no burning sensation and reduced risk of allergic reactions locally. And they come in the single dose blisters, and they're 0.5 ml each, enough for top and bottom application. So this is what they look like in our surgery. So that particular one was the berry flavor. So you can see that that gel is transparent and it's a non-clumping formula. So it glides on beautifully on the surface of the teeth, which is quite different to what we've been used to before. So we will see that clumping formula that has a yellow color, whereas this is clear, transparent, and really nice, glides on smoothly. This is actually my nurse who had fluoride varnish applied to the surface of her teeth. So you can see that her teeth look the same as before. So this is immediately after application of this fluoride varnish, and I've applied it to all the posterior teeth. So this single dose blister is enough to cover all of those teeth, and you can see that her teeth look the same as before, maybe a little bit shinier where I've applied this fluoride gel. And I don't know about you, but this is one of my favorite things about it, and one of the patient's favorite things about this particular product when we switched is that you can't notice it almost unidentifiable. So how is this streamlining workflow? So the single dose blister is amazing because you're reducing waste. You're not having to go with a pad and apply that and micro brush and make sure that it's clean. And if you put too much, you're not wasting product. And if you're not putting enough, then to go back and make sure that infection control policies are respected. So it makes everything really easy and smooth, and it streamlines your workflow. You don't need to clean the teeth prior, and you don't need to dry the teeth, and that significantly reduces the clinical time that you need to book patients in for to apply the fluoride. So the transparent and colorless property also means that therapists or hygienists, again, so what we were saying in the model where a therapist or hygienist might see the patient before they come in your chair for an examination, that means that they can have the fluoride varnish applied and you can continue to examine the teeth because you'll be able to see them as before. And that really is beneficial in that streamlining workflow process. Patients tend to tolerate it a lot better because it's not burning, there's no color, there's no flavor if they don't like the flavor, or they can choose their flavor of their choice. So children might opt for the berry flavor, whilst adults might prefer the mint flavored, or a lot of patients, adults or children, might prefer the unflavored. That's my personal choice as well. And it's quite cost effective for the amount of time that it takes for you to apply in terms of your chair time. It's not very much at all. And it's kind of repeat business in that the patients are coming again and again, and it's good for them and it's good for the practice as a practice builder. So if we compare the release of fluoride ions by Profisil Fluoride Varnish compared to the competitor product, so you can see that from when it's from application, it continues to release fluoride up to 24 hours. And for the Profisil Fluoride Varnish, it will release a lot more fluoride than its competitor. And if we go back to the slide we had earlier, this is the cross section of the tooth under the microscope. So if we look at what baseline is in terms of open dentinal tubules in cases of dentinal hypersensitivity, and we look at the competition and how it seals those tubules compared to Provisil, we can see that it's a much superior sealant, and that's because of the chemical composition. So there is a continuous phase with the dimethicone ingredient of the fluoride varnish. It just allows better coverage of those dentinal tubules for symptomatic relief, and we can see on the previous graph that it lasts a lot longer as well. So it gives excuse me, it gives superior protection for longer compared to the competitors at the moment. So, in conclusion, if we sort of recap everything that we've covered about fluoride varnish, we know that application of fluoride varnish is an essential step in preventive dental care, not only for adults, but also for children and for those who are high risk of getting tooth decay. Um, it's recognized as a safe and effective preventive method for maintaining dental health, whether that's to address high caries risk or dentinal hypersensitivity. It's a very, very effective solution. It is also excellent for cavity prevention, so it can actually get incorporated into the chemical structure of the tooth to make it stronger and more resistant to dissolution by acids. So when that critical pH is hit, so if your patient is very high caries risk, they have a cariogenic diet, then regular application of fluoride varnish is going to go a long way in helping protect their teeth against tooth decay. And studies show that there is a significant reduction in caries incidence when fluoride varnish is used, and that happens by strengthening the enamel. So regular application of fluoride varnish helps to reinforce the enamel, enhancing overall oral health. And we've also covered the benefits of Profisil Fluoride Varnish compared to the competitors, not only from a patient perspective, so in terms of the superior protection that it gives because it has that dimethicone base, it's alcohol free, so it's less likely to have sort of adverse reaction, local reactions, or burning sensation by patients. We have the choice of flavors, which goes a long way. It's transparent. It is easy to tolerate by patients. I mean, I've had both types of fluoride varnish. I've had Profisil as well as the regular competitors over my career, and I can notice a huge difference in just the texture and how it feels in the mouth. It feels very pleasant. You hardly notice it, and we know that it gives superior protection as well. So from a patient standpoint, it's very well tolerated and it's comfortable to have. That's going to increase the uptake of patients, and it's also going to really help be a practice builder. So patients, if they tolerate it well, they know that every 3 months, every 6 months, they're coming in to have that treatment done. They don't sort of try and get out of it. Whereas if it was an unpleasant experience, most people, especially children, would try to kind of get out of it and maybe they won't return. So if they have a bad experience. So it really goes a long way in enhancing the patient experience. And from a clinician standpoint, it's really easy to use. It's really um, user friendly from your nurse's point of view, in that they come in those single dose blisters and they enhance infection control procedures. So you're not having to faff around and worry about whether the pad is clean or whether the microbrush. Where it's coming from and all of that. It's all in one packet, and you have the exact amount that you need, so you're less likely to waste any product. So it's good from a practice point of view as well. And in terms of the application process, there's no pre-cleaning or drying required, and that's really, really comfortable for clinicians as well because you're not having to spend that extra clinical time. So it streamlines the workflow as well as make your clinical hours a bit more productive as well. So you don't need to clean the teeth, dry the teeth, or send them to the hygienist beforehand. You can, of course, but you don't have to. And it also means that in practices where the workflow is such that the patients might see the hygienist first and then the dentist, and if the hygienist is applying the fluoride varnish, then the dentist can carry out their examination as well because the varnish is transparent and it's clear, so it's not obscuring your vision and your assessment. So it works great in streamlining that clinical workflow. Um, I hope that's been a very useful lecture. It's a shame that I can't take any questions like this, but of course I'll be happy to take them if you send them in, and we can respond to them later on. But I hope that's been a really useful lecture for you to know about, just to recap fluoride varnish in general and how valuable it can be in modern day dentistry, and how using Profisil can enhance your clinical workflow and the patient experience as well, and help be a practice builder. So thank you so much for your time and for listening. And yes, I hope you have a lovely day.